Today, we are going to discuss the basic implant procedures, irrespective of the specific implant brand. First thing is the case selection. For that, we need to take a detailed medical and dental history. Once we have selected the case, we need to do a pre-treatment planning and take the patient record. And I would like to emphasize that one should really spend good amount of time and efforts in pre-treatment planning. That will avoid the surgical complication and anxiety during the implant placement procedure. So that pre-treatment planning is done with the help of implant patient study models. It is done with the patient photographs and also the patient radiographic examination. In the radiographic examination, we should take intraoral intraoral radiographs. We should take the OPG radiographs, and the most important thing is we should have the CBCT scans. The CBCT scan will give us a quite a detailed idea about the bone volume, about the bone buccolingual dimensions, mesodistal dimensions, and about the space of from the crest to the anatomical landmark, whether it is a nerve or whether it is a medullary sinus. So we should really take time to understand the bone volume, bone size, as well as the bone density. Once we have taken the patient records and have done the pre-treatment planning, now it is a time to make a surgical guide. Now, surgical guide can be an advanced kind of CBCT guided surgical guides, or it can be a very basic surgical guide like what I have shown here, where we have made an acrylic tooth and I made a hole in that acrylic resin, which is the ideal position where the drilling should start. So if it is a case of replacing anteriors, then we need to start drilling at the cingulum area. If it is a case of a posterior tooth, then the drilling should start in the center. Of course, taking the basic fundamentals of implantology in consideration, which should include the space between the implant and the tooth, the space between the implant and the implant, and the space between the implant platform and the buccal bone. But this will give us a very helpful aid in placing the implant in the perfect 3D precise position, because after giving anesthesia to the patient, we will make a small hole through the gingiva into the bone cortex, just like perforating it slightly, to have a basic idea where the future crown will be placed. And after the reflection of the flap, we will proceed with that small hole, and if we need to change some direction of the drilling, we can do that. Additionally, after the implant, the first hole is drilled, we can use a paralleling pin, and that paralleling pin will give us a quite a good idea about the implant, the future implant position and the implant drilling. Because once we take the radiograph of the paralleling pin, we'll have a clear idea that where we are going to drill, how our the landmarks are away from the drill, and how we are going to proceed. So and this paralleling pin will also show that when after the implant placement, what will be the dimension or what will be the space between that implant and the adjacent teeth, or between the implant and the another implant, and how much bone will be there outside the implant. The buccal bone will be left outside the implant. So after this paralleling pin, we can go ahead with the drilling protocol as suggested by the implant manufacturer, so which includes the torque as well as the speed of the implant drills. Once we have made an osteotomy after the osteotomy is made, now we are ready to place the implant as per the manufacturer's instructions for the RPM as well as for the torque. So after the implant placement, we can cover the implant either with a cover screw or with the healing abutment and can do the suturing. The patient is discharged after giving the post-operative instructions and the necessary medications. Thank you.